All right, good morning. Thank you so much for joining. My name is Rachel Krug. I'm the CEO of Virtual Field, and I have Dr. Steven Rosenfeld on with us today. We're going to be discussing how efficiency at your practice can lead to a better patient experience. Dr. Rosenfeld, would you mind briefly introducing yourself?
Hi, I'm Dr. Steve Rosenfeld. I'm a practicing ophthalmologist in Delray Beach, Florida, and happy to be part of this webinar today.
And as we go, if you have any questions, feel free to put them in the Q&A. We will be addressing any questions at the end. So to start out, we'll define the patient experience. And this is the range of interactions patients have with the healthcare system. It could be anything from care from their health plans to doctors, technicians, but also includes things like timely appointments and good communication with healthcare providers. So it's a really holistic experience. We found a survey by the Barrel Institute, which had some surprising findings, that 76% of patients said they hadn't had a positive patient experience in the prior 3 months, and 60% said they had a negative experience. So this is the majority of patients saying either it wasn't positive or it was definitely negative. And this was a recent survey in 2022 with 1,000 Americans. A better patient experience is important for many reasons, including increased compliance with treatment, lower employee turnover, reduced risk of malpractice suits, and higher patient retention. We know you want your patients to stay and retain and come back and follow their treatment instructions. So we'll go through a few quick tips here. The first is to survey your patients. So gather feedback to identify problem areas and understand patient preferences. Dr. Rosenfeld, would you mind sharing how you have surveyed your patients?
Yes, thank you. In our practice, we periodically, every couple of months, will have a week where we survey our patients as they check out at our checkout desk after they've had their appointment. And it's been very enlightening for us to see what patients' perceptions are about the way things run. We look for both positive and negative feedback from our patients. And ideally, also, we're looking therefore for actionable items, things we can do to change and improve on the patient experience. And patients really do feel empowered when you ask for their opinion about things.
That's great. That's great that they feel empowered and that you are also listening to that feedback and making changes to accommodate. Thank you for sharing that. The next is to reduce wait times. So ensuring a smooth patient visit and follow-up helps with the patient experience. Dr. Rosenfeld, do you mind talking about how you orchestrate the waiting room experience?
Sure. Is one vignette and one, I think, very important part of our practice is that I am a cataract and refractive surgeon. So I do lots of elective procedures on patients like LASIK and PRK, refractive lens exchange, even corneal cross-linking. These are the procedures not covered by conventional insurance. Patients have to pay out of pocket. So it's important to make them see that they're getting value for what they're paying for. And we have a lifestyle coordinator who's someone whose job is the minute the patient gets to the practice, she escorts them around from place to place so there's no wasted time, so that things are done in a very efficient manner, and impresses upon the patient what an important priority they are for us during their visit to our office.
That's really interesting. How did you come up with the idea of the lifestyle coordinator? I'm curious how that originated.
Well, it sort of evolved over time, and when I've been involved with LASIK, in fact, even prior to its FDA approval, and that was one of the first of our elective procedures or patient pay procedures. And patients are busy people. The people coming in for LASIK are not Medicare patients that are retired with lots of time on their hands. Time is a valuable commodity. A way of showing patient respect is keeping to a schedule and not wasting their time. But it's important because otherwise these patients can kind of get lost in the sauce. And you may want to impress upon them that you have cutting edge technology, but if you have old-fashioned patient processing, it falls flat on its face.
Sure. Thank you for clarifying that. The next tip that we have is to implement automation. So things like payment reminders takes work off your staff and reminds patients to pay, or reputation management, where you're asking patients to review their experience, and that gets you reviews, but it also gets you great feedback on things that patients liked or didn't like. Dr. Rosenfeld, could you talk a bit about how you have implemented automation in your practice?
Yes, we've used it on many levels. One of the most important actually relates just to appointment reminders that a patient a week before their appointment and a day before their appointment will receive text messages from our practice, as well as email reminders. And the patients are supposed to let us know if they can't attend. And, there's a number to press. And it's important because there's nothing worse than having time set aside for a patient, especially if it's a new patient or a consultation and they don't show up. It's hard to sometimes fill an appointment at the last minute. And that has been very helpful. In addition, when we know someone's coming in for a cataract consultation or refractive surgery consultation, we will send them usually via text message, although sometimes via email, websites that they can click on to get patient education, learn more about the procedures, learn more, for example, in cataract surgery about options with premium lens implants and lasers. So we've planted seeds and started the whole patient education process prior to their even coming to the office for that first visit.
Great. And related to what you were saying with appointment reminders, simplifying scheduling definitely creates a better patient experience. Can you add on to the scheduling process if they are going to schedule a surgery? How does that work? How do you simplify that for them?
Well, we do have a phone tree in the office. So if somebody calls up that they're interested in surgery or want to schedule surgery, that then they press the proper number, that automatically goes to one of our surgical coordinators. So that is expedited, not going through the usual phone tree and the standard appointment secretary that may answer the phone. The other thing which we don't do, which I think has merit and hopefully we'll be switching to soon, is that patients have the capability with many EMRs, or when they're on your website, they can actually make an appointment while they're learning about your practice. And that also frees up an individual from spending 5 minutes on the phone scheduling the appointment. It gives the patient maximum flexibility in selecting a convenient time. So that's something we aspire to, quite honestly.
That's great. That's great. Thank you for sharing that. Our next tip is to optimize technician roles. We know how important technicians are to the practice. So creating doctor-technician teams for focused patient care. I'm sure there's other ideas on how to optimize their role to improve the patient experience. Dr. Rosenfeld, would you share a bit about how you've done this with your team?
Well, it's really a lot of common sense, and it's something we've been doing for several decades in our practice, but we have a specific technician and now even a scribe assigned to each doctor. And as you might imagine, working on a day-to-day basis with the same individuals, they know what it is that you need from your patients before you ask for it, and even if it's not entered in the medical record as being necessary. So patients coming in for cataract consultations, we know that they need corneal topography to see if they have astigmatism, that they need to check if they've got corneal higher order aberrations, so they wouldn't be a candidate for a multifocal lens. And somebody coming in for LASIK will need to have topography or pupillometry or certain other testing. And it's so much easier working with the same team that knows what it is that's necessary. And in fact, a good assistant will often provide something even if you forget to ask for it yourself.
That's great. And I'm sure the patients appreciate that. Could you talk a little bit about patients developing relationships with the technicians as well?
Well, yes, and actually, there's two prongs to that. One thing which would fall into the previous category, as well as the technician relationship with patients, is another thing that a good technician can alert you to is if the patient is angry, if they're not satisfied with their surgical result, if they're just upset because they've been waiting too long for that particular visit. Because to be forewarned is to be forearmed, and to go in knowing that the patient's already a little upset, you can validate their concerns about the fact that they may not be seeing the way they want to, or explain why it is you were running late before they even have a chance to pounce on you. So getting those sorts of heads up from your team is very important. But the other thing that as far as personalizing the experience and it comes partly from the technician roles, and relates to the slide that will follow, is that I will often have little notes in the chart, things to remind me about a patient, and if they've had certain life cycle events, if a grandchild's gotten married, if a granddaughter's in medical school, if someone you know is having some major operation, and you can inquire about that, it really makes them feel that you care, that you remember them, that they're not just another patient or another number. And as I say tongue in cheek, but there's an element of truth to it, that it often disarms the patient too. When you start asking them about some of these their personal experiences, or these events that have gone on in their lives, it makes them forget about a lot of their complaints and some of the less important things that can sometimes bog you down in the course of a visit.
Yeah, I think that's really a great tip, to add those notes to personalize the experience to help you build relationships with your patients. Makes a ton of sense. Thanks for sharing that. So in conclusion, we've hoped you've gained some tips on practice efficiency and patient experience. From check-in to exam to aftercare, having an open dialogue with your patients while also respecting their time is a positive for you, your patients, and your team. Dr. Rosenfeld, anything to add in conclusion here?
Well, I have a couple of items. I think that in terms of efficiency, there are two other things that I might throw in.
Sure.
One is that it's very nice to be able to accommodate patients, even if they're not scheduled for certain things. And something that has really helped in my practice is the use of the virtual field device. And that's something that is a virtual field headset. And you're able to do visual fields, therefore, on a patient sitting in an exam chair. They could even be sitting in the waiting room. And many times patients come in and it's like, oh, gee, I wish we had ordered a field, or I wish we could get them in to have had that field prior to me seeing them. And patients are very impressed when you say, look, we have this brand new device. It'll talk to you. It's virtual reality like your grandkids talk about. And you can get a visual field right at that moment. And it's good for patient care and quality of care, but it really does impress patients. The other thing we do also that has helped with efficiency, and we've recently had installed in all of our exam rooms a device called Checked Up. I have no financial interest in that, but it's a large flat panel that's in the room, and a patient has the option to choose different types of surgical procedures or review eye anatomy or different disease processes about ophthalmology while they're waiting in the chair. It's nice because it keeps them occupied, but once again, it's a great way that they're being educated during what would otherwise be downtime. And even I would go to the extent that it helps free up your technician, because they can say, look, why don't you watch this quick video on the femtosecond laser and cataract surgery, and they can actually move on to the next patient as well.
Thank you for those technology tips as well. Great to hear. And we can open this up for questions at this point. We do have a question here that the webinar discusses the relationship between a positive patient experience and better health outcomes. Can you provide an example of a specific health benefit that resulted from a good patient experience?
Well, I think in general, when somebody is angry, or somebody feels that they're not being dealt with properly in the office, or you're running terribly behind and no one's explained why, they feel they've been ignored. Patients then they're just perseverating about how angry they are and who they can vent to in the office, and sometimes they really just don't listen. They don't listen to your explanation about their visit, about their disease. This is the patient that more likely than not will call you the next day and say, gee, you never spoke to me, or I don't remember what you said about my glaucoma. And then you're on the phone spending another 10 minutes about something you spent time with. So keeping a patient feeling good about themselves does make a difference. And feeling that you're listening to them, that you're validating their feelings, I think goes a long way.
Sure. So better compliance from a better experience because they understand more. That makes a ton of sense. Thank you. We have another question. You mentioned using surveys to gather feedback from patients. Could you provide guidance on effectively designing and implementing patient surveys to identify specific areas of improvement and enhance overall patient experience? Great question.
Well, those are sorts of things I think you can find probably online. And, there may even be things on the website for the American Academy of Ophthalmology, or for probably not OMIC, the malpractice insurer, but the American Academy, or the ASCRS, the American Society of Cataract and Refractive Surgeons, because there's a lot of things that may be very obvious to you and some others you may miss. but patients are concerned about if it was easy making an appointment for the office, how they felt they were dealt with while they were in the office, was their time used efficiently while they were at the visit, did the doctor spend adequate time answering their questions. And it's a lot of sort of common sense. I think anyone can think back to their own experiences in a doctor or a dentist's office and what they liked and didn't like about things. But there are things online, I'm sure, that can help guide you so that you keep it short, but you touch the salient points.
Great, thank you for that. Also, I can add on to that a bit. In my experience, if you're not sure where to start, it's helpful to start with open-ended questions at first, because you don't know what you're going to discover. And then by asking those open-ended questions, you'll start to hear themes, and you can refine surveys over time to be more closed-ended as well, with specific answer choices. So that there's an idea for you as well. We have another question. The idea of creating doctor-technician teams for increased efficiency is mentioned. How could teams be structured to effectively optimize patient care and communication, while also allowing for flexibility in unforeseen circumstances?
Well, that's a wonderful question, a very insightful question, because it's a double-edged sword, because the more closely you work with one given individual, sometimes then other people in the office won't necessarily know your routine. And you do want to have the ability for your technicians or scribes to cross cover and work with other doctors in the practice. That's a particularly germane question for my practice. We are a 9-person practice. We're multi-specialty. We have at least one of all the subspecialties of ophthalmology, if not 2, all under one roof. So if they're working with a retina doctor and then suddenly they have to come and take care of my cataract patient or corneal transplant patient, yes, it's a little different than what they're used to. So there's a delicate balance between working exclusively with one person, but it's important to provide the cross training so they're comfortable working with others. One thing that we do is we have made up little like one-page sheets that explain what it is that we need for some of our more common patients. So the glaucoma doctors in my practice know that the patient needs to have a visual field or gonioscopy done before dilation, or certain things on that first visit as a glaucoma consult. They know that I need, as I said, for, let's say, a LASIK patient, they need corneal topography and pupillometry done first. So anyone can just look at the sheets and, oh, this is Dr. Rosenfeld's LASIK patient, and they'll know the important things that need to be done and even how things are orchestrated, so that they have something to refer to on their own.
Great, thank you. And I think we have time. We have one more question, and we should have time to answer this one more. Can you elaborate on the distinction between patient experience and patient satisfaction?
Well, I will say, and to give another plug, but something that I think is very worthwhile for you, whether you're a physician, a technician, or even somebody in the business end of a practice. But there's a book called Beyond Bedside Manner, written by a friend and colleague of mine, Sharif Madavi, who's been an ophthalmology consultant for 25 years out in California. And he goes into this whole mindset that this is really, we're involved not in a medical practice, but it's customer service these days, that we need to improve the patient experience, that a lot of the younger patients even consider we're an experience economy. People are more concerned with experiences going on trips and doing things in amusement parks than they are sometimes with other aspects of life. And that we need to be treating patients like guests. In fact, that he goes to make the analogy that it's like running a hotel, that these guests, the customer's always right. We have to be very patient-centric. And so devoting time and attention to the patient will improve their patient satisfaction, but it starts with realizing that without the patient, we wouldn't exist.
That's amazing. That sounds like a great book recommendation. I definitely want to read it. Thank you for sharing that. Thank you, everybody, for attending and for your questions. I put in the chat, Dr. Rosenfeld was kind enough to write up this information as a blog post as well. So if you'd like a takeaway and a reference, you can refer back to that post. And we appreciate your time. And thank you so much for being with us.
Thank you. It's a pleasure speaking with you today.